It's not as hard as you think. It doesn't require a lot of money. It doesn't require a lot of time. You just need to know what steps you need to take. So the first step you need to take in order to go from nurse practitioner to medical entrepreneur is to identify a market with demand, preferably a market that is outside of mainstream medicine. And what that means is basically a market that is a cash market, right? The people pay for their medical supplies with cash. People pay, for their services with cash. You're not having to file insurance claims and wait for an adjuster to tell you they're not going to pay you as much as, as they initially said, or that, you need to submit more documentation or that kind of stuff. So there's kind of 5 areas that are of high demand that I would look into. Number one, the biggest area, kind of the easiest area, I would say, is weight loss. Weight loss is a huge, huge market. It doesn't take a genius to figure that out. There have been so many, many large companies built in weight loss space, and people continually need to have weight loss solutions. And for a lot of people with, health concerns, losing weight can not only change the quality of their life drastically, but it can extend their life drastically. Just imagine if you have someone who is, borderline diabetic. Maybe they have some cardiac issues. Maybe they have other things going on, and you're able to help them lose weight. You can improve their quality of life. You improve their self-confidence. You improve their self-worth. All of these things compound, and it really results in like a whole different change for that person. The number 2 area I would say is aesthetics. Aesthetics is still a booming field. So if you're a nurse practitioner and you enjoy beauty, you enjoy, the idea of Botox, fillers, PRP, microneedling, lasers, these kind of things you enjoy, you enjoy taking care of your skin, you like skincare, that kind of thing. Aesthetics is probably still the fastest growing field that I've seen. And it's a very, very strong market. And there's ways to start in aesthetics that are not as expensive as you might have been aware. A lot of people start in aesthetics, they think, I have to, get a med spa, I have to build out this huge build out, buy all these machines. I would not start that way. You can get started in aesthetics just by doing Botox parties for the most part, and selling skincare. And then from that, use that cash that you earn from there to basically eventually open your own physical location, which you offer more services, et cetera. Then buy your machines from that cash and kind of build it up that way. The other area that's pretty booming is hormone replacement, and hormone replacement is huge. Just so you know, there has been a lot of data coming out about how hormones have been drastically affected by many of the particles of plastic that are surrounding us in our everyday lives. If you look at a lot of the studies that are coming out, they indicate that, male testosterone is at all-time lows. A male today that is 35 on average has 20% less testosterone than a male who's age 35 in the 1980s. And the same thing is happening with females, although it's not as greatly discussed. But there are significant issues with hormones. And for a lot of people, by offering them hormone supplementation, offering them hormone replacement, you can improve their quality of life drastically. Additionally, many of the customers that are seeking hormone replacement and seeking these are people that are high performers that wish to actually perform better. So they're very, very good customers. They often don't have a lot of other comorbidities or illnesses. They themselves are actually looking to reach their peak or looking for your help to reach their peak. And it's a great set of customers that you can work with, great set of patients you can help, and you make a huge difference in someone's life. Another area that you may consider is regenerative medicine. Regenerative medicine is continually to increase. There are so many people with joint issues, pain-related issues, these kind of things that are essentially not given many solutions by mainstream medicine. These include patients with neuropathy, patients with arthritis who don't want to have surgery. Many times patients with chronic, injuries that haven't healed. You can use a lot of your training in regenerative medicine to basically help these people go and regenerate part of their body and live a normal life. It's really quite amazing. One of the things that I've been lucky enough to do is to work with the American Arthritis Foundation and watch as they have basically put together a protocol which has some regenerative medicine components into it, and see the amazing things that they've done, because there's a lot of people out there who have, for example, knee osteoarthritis, and they don't want to have surgery. They know other people who've had surgery, who have had complications. They're not interested in these kind of things. And I'm not here to tell you pro surgery or against surgery. I think there's cases for both. I will say that I think there's a lot of incentive in the mainstream medical system to push people to surgery because there's a lot of vested interest in that within hospital corporations, for example. There's a lot of people who are just saying, hey, look, I'll be happy to pay cash. Just find a way to fix this without me having to go under the knife. And so regenerative medicine continues to grow. Another area that's always popular, functional medicine. There's a lot of people that have, illnesses that they maybe have been to 3 or 4 different doctors. The doctors are taking insurance. They get exactly 5 minutes with the patient. It's really not enough time to figure out what's going on. These patients have very complex illnesses. Many times these can be treated with alternative therapies that are quite effective. And you can basically become a functional medicine practitioner and help people through that mechanism as well. So once you identify a market, the 5 major markets, once again, are weight loss, hormone replacement, regenerative medicine, aesthetics, and functional medicine. Of the 2, I think the top performing are going to be weight loss and aesthetics, which kind of go hand in hand anyway. So pretty cool there. But once you identify a market that you would like to treat, the next thing all you have to do is to build a company.